Well, top of the moment to you, anywhere where you watch us from. Welcome to Health Matter. And on top of Health Matter, now they take discuss everything with the health related. And then our chief Olododos. Let me see there with me and Dr. Bartolomeo Ofegbunam, CEO, Grace Value Medical Center, and also a medical consultant. Good morning, sir.
Thank you very much. Good morning, Chief. Slimy.
Good morning, Doctor.
I'd like to welcome you back.
Thank you,
Good
sir.
to have you.
Good to see you too.
I'm sure last week you were not here.
Yes, I was.
Yeah, thank you once more. My name is Dr. Ofegbunam. I'm the Medical Director of Grace Valley Medical Center. This morning, we'll be looking at HIV/AIDS. Every December 1st is regarded as World AIDS Day. World AIDS Day. Okay? So it is a time that globally there are efforts, progressive efforts that have been made over the years. It's a time to assess where we started in the fight against HIV, where we are now, and where we want to be. Okay, so this year's World HIV Day was different from the ones we have had before now, in the sense that a lot of significant efforts have been made, a lot of achievements have been attained over the years in the fight against the scourge called HIV, which of course we all know is a pandemic of global proportion. Okay, now HIV, I want us to look at what HIV is all about. Okay, we are going to look at the definition of HIV, but first we'll start with the history of HIV. There are a lot of versions of history, where it originated and all whatnot. A lot of controversies surrounding the origin of HIV and all whatnot, but it's important we know 18 or 2 about the origin of HIV. And then, of course, we'll give a definition of HIV. We'll talk about the types. We'll talk about the risk factors, the causes of HIV, the diagnosis, as well as treatment, if time will permit us. Okay? Now, let me start by saying a thing or two about the origin of HIV. Over the years, there has been argument as to where HIV originated from. Some say it originated from Africa, precisely West Central Africa. Okay? Some authorities too, some researchers also said it originated from Cameroon, while some others said it originated from Congo. Okay? But in 1931, researchers believe it was the first time they had what looked like HIV/AIDS. They have a documented evidence of what looked like HIV/AIDS. Okay? But it didn't have the name HIV until the 5th of June 1981 was actually when CDC in the United States of America actually gave the name HIV/AIDS to it. Okay, but long before, in the history, in the versions I have that it originated from Africa, it was believed that it must have originated from chimpanzees. Okay, it was believed that hunters that came in contact with chimpanzees must have gotten in contact with the blood, must have picked up the infection from there, and then from then onwards, it spread to all other parts of the body, all other parts of the world. But I want to narrow down to the U.S. account that is easily verifiable. Okay? Now, there is a young man, or a 16-year-old American boy by name Robert Ray Ford. Okay, that's the name of this young man, who was discovered to have HIV in the U.S., but not by the name HIV at that time, in the year 1968. He had an illness that had classical symptoms, very unusual, that they've not seen before that time. People didn't know what it was. He had some age-defining cancer that we now know today as Kaposi's sarcoma at that time, but people did not know what this boy was suffering from. As a matter of fact, he was taken to a number of hospitals in St. Louis, Missouri in the US, was taken to a number of hospitals over a period of time, but eventually he died in the year 1969, precisely on the 15th of May, 1969. Recently, earlier in the year, Washington Post actually carried a news on the discovery of HIV vis-a-vis with this particular individual in mind. So what actually happened was, when he died, some of his tissues were frozen, were taken, because they needed to carry out more research concerning the illness that this guy that this young boy is an African American may have suffered during his lifetime. So it wasn't until 20 years later, precisely in 1985, when there was an avenue to test for HIV, that they went and then retrieved those tissues of his that were kept. And of course, they tested it with about 9 different testing kits, and it showed positive to all of that. So that means that the documented evidence of HIV being in existence in the United States dates back as early as 1969. And of course, as a result of those investigations that were carried out, they could actually come up with a diagnosis long after this individual had died several years ago, that he actually had and suffered AIDS at that time, even when people did not know what it was all about. Okay, so the history that has to do with Africa, you always notice that they will say probably originated at about, it was not specific. The only specific history that we can lay our hands on is actually the one I've narrated. The young boy by the name Robert Rayford, okay, who lived and died in 1969. That should be about 50 years ago. Now, HIV, the name simply means human immunodeficiency virus, okay? AIDS, acquired immunodeficiency.
Yeah, no, deficiency.
Disease, yes,
Disease,
okay? AIDS, okay? Now,
Okay,
AIDS was actually discovered first before 3 or 4 years later. AIDS was actually discovered in 1981, I said in the 5th of June precisely, among 5 American adults, homosexual American adults. They didn't actually know what it was all about at that time, but until the year 1981, when they actually put the name AIDS to it. And much later, a few years after, it was discovered that HIV was actually responsible for this disease. But before then, they called it all sorts of names. Some called this the GRID disease, okay? Gay-related immune disease. In some other places, they refer to it as the 4H club or 4H disease, because the disease affected a certain group of people. It affected heroin drug users, that's the first H. It affected hemophiliacs, people who have challenges with blood clottings. It affected Haitians, people that are from Haiti, okay? And then if I remember the fourth H, I will mention that. So it was regarded as 4H disease because of the number of people it affected: heroin drug users, hemophiliacs, and then Haitians, and then one other one that I can't quickly remember now. Now, HIV, we all know, has to do with the destruction of the immune system of the body. Now, in the human body, we have a number of cells, usually the white blood cells, whose duty is to combat and protect the body and fight infection and protect the body from diseases. So what happens is that when somebody picks up this infection, there will be a gradual destruction of this immunity of the human body. Usually we refer to them as the T lymphocyte or the CD4 T cells. Okay. Now, this gradual destruction or depletion, if the person remains untreated over a period of time, it progresses over to AIDS. Okay. Now, but when we talk about HIV/AIDS, it's actually a spectrum of diseases. At one end of it, you have HIV when the person picks up the infection, the primary infection, and then it can progress, if untreated, to the level of AIDS, at which time it must have destroyed the immunity of such a person's body, and the person will be prone to a number of opportunistic infections around the person, which could be as a result of fungal infection, parasitic infections, viral infections. Okay, but HIV itself is primarily a viral infection. It's an infection that is of viral origin. A number of viral infections are usually self-limiting, but HIV is not self-limiting. Self-limiting means that sometimes if you don't do anything, those diseases will resolve on their own. A good example is catarrh that we all know, okay, or coryza, okay? That's the medical name for it. Now, what are the types of HIV? We have HIV-1 and we have HIV-2. Now, HIV-1 is regarded as the most virulent of the two types, okay? HIV-2 is believed to affect mostly people from West African sub-region, and sometimes someone can have both HIV-1 and 2 at the same time, okay? So they're just subtypes, okay? What are the symptoms of HIV and what are the stages of HIV? That's the question I will answer next. Now, the symptoms of HIV will range from the stage of the disease. Of course, there are 3 stages of HIV. Number 1 is the acute stage. Number 2 is the chronic stage, okay, or the clinical latency stage. Number 3 is the AIDS stage, when the immunity of such an individual would have been completely destroyed. Suffice to also say that someone can pick up the infection and not show any symptom at the initial time. So let's talk about the acute HIV, which is the first stage, or the primary HIV infection. When anybody picks up the infection, what happens is that within a space of 2 to 4 weeks, this does not happen in all individuals. Within a space of 2 to 4 weeks, there will be what we refer to as flu-like symptoms that such an individual may have. This can range from fever to sore throat and to weakness and malaise. This can last for a short period of time, few weeks to some few months, and then it resolves. In some individuals, they could also have lymph node enlargement at the first stage of HIV, talking about the acute stage. Okay, now, after those series of symptoms, the person can become well again. Those symptoms can resolve on their own, and then it enters the chronic stage. The chronic stage, it can actually last from 3 to 20 years, even without the person knowing that such a person have the disease. So that is the clinical latent phase of HIV. In some situations, in some people too, it could show with some symptoms, ranging from some of the initial symptoms I've mentioned: fever, sore throat, recurrent upper respiratory tract infections.
Malaise.
Yes, malaise. Okay, that's weakness, fatigue. When we talk about malaise, means general feeling of unwellness.
Malaria.
No, not malaria. Okay, so that is the chronic phase, and it's at this chronic phase that gradually over time the immunity of such individual is destroyed over time. So if the person is not on treatment, it can actually progress to the 3rd and final stage, which is actually the AIDS, acquired immune deficiency syndrome. At the time the person has AIDS, such a person would have had a CD4 count of less than 200 mmQ, okay, or microliter per mil. Okay, so such a person's CD4 count would have reduced to below 200, and the person can have some AIDS-defining symptoms. Such a person can have Kaposi sarcoma, and the person can have some other cancers that are associated with HIV, like lymphoma. Okay, the young boy whose story we told at the beginning actually suffered from Kaposi sarcoma at the time he had those symptoms, and people didn't actually know, because it was a rare finding to have such in a 16-year-old. Okay, these are things that they usually find in the elderly people. Okay.
Sorry, doctor, we need to go on this break, and I'm sure Health Matta will be back, where we'll open the phone lines and you can ask any question as far as is related to AIDS or HIV. Go nowhere.
Health Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit also advertise your product and services on top we show wey dey help people. Terms and conditions apply sha o.
Stands for Acquired Immune Deficiency Syndrome, which means deficient immune system. You get AIDS after becoming infected with the HIV virus. You get infected with the virus by unsafe sex, contact with blood of an infected person, for example by using a contaminated injection needle, from mother to child during pregnancy, childbirth or breastfeeding. Because the virus is transmitted through blood, sperm, vaginal fluids, preseminal fluid, breast milk. You don't have the risk of becoming infected with the virus by saliva or shaking hands. When you have HIV virus but aren't symptomatic yet, you are seropositive. That means that there are HIV antibodies in your blood. You don't need to have any signs of disease yet. An HIV infection passes through 4 stages. In the first stage, the body can show signs of disease like continuous fever and swollen glands, while some people who are infected remain asymptomatic in their first stage. In the second stage, recurring airway infections, skin, mouth, and genital lesions often occur. In the third stage, you may have complaints like prolonged diarrhea, excessive weight loss, tuberculosis in the lungs, and other serious infections like meningitis. Finally, besides serious infections, the nervous system may be affected in the 4th stage, which can result in motor loss or AIDS-related dementia. It may take 5 to 15 years before you know that you've got AIDS. This is because sometimes it takes longer for symptoms to occur. HIV and AIDS can be treated with medication but can't be cured. Antiretrovirals slow down the multiplication of the virus but doesn't kill it. To support the treatment, AIDS patients often get medications to boost the immune system and fight against infections. You can prevent AIDS by having safe sex and using clean needles.
Yes, you're welcome back. We don't hear from the video we just watched on how to really prevent AIDS. But Dr. Bass today here when they break down everything we get to do with HIV plus AIDS. Okay, sir.
Yeah, thank you very much.
You're welcome, sir.
Yeah. Now, I want to take us out some of the new statistics that we have for HIV at the moment. As of the end of 2018, globally, about nearly 38 million people were said to have been affected by HIV. WHO actually put the figure at 37.9 million people were said to have been affected by HIV at the end of 2018. Out of this figure, about 79% of them were tested for HIV. Out of the people that were tested, about 62% of them were receiving treatment for HIV. And 52% of these individuals were able to achieve suppression of the virus to the extent that it was able to reduce their ability to infect others. Okay, so that's a landmark. There have been some landmark achievements as far as the fight for HIV is concerned on a global scale. A lot of people now know their HIV status, unlike what it used to be before. Today, HIV is regarded as a chronic illness that one can easily manage. As a matter of fact, it is widely believed by scholars and researchers alike that if one is able to achieve if one is able to suppress the viral load to an undetectable level, the person will actually not be able to transmit the infection. So there's this slogan that's undetectable equals to untransmittable. If you're able to reduce the viral load to a level that is undetectable by test, that means you have been able to reduce it to a level that cannot be transmitted from one person to the other. So as a matter of fact, two partners, okay, or a couple, if I may use that word, if you have a situation where one is infected and one is not, the truth of the matter is that the infected person, if the person has been on drug for a certain period of time, can get to a stage where such a person will be able to have suppressed the viral load to a level that will be undetectable. And at that level, such person has been able to reduce his or her ability to transmit the infection to others. So that is a landmark achievement, unlike what we have some years ago. We have Lawal from Niger. Good morning, Lawal.
Good morning, sir.
How are you doing, Lawal?
I'm fine, sir.
Okay, the doctor is here. Go ahead with your question or contribution.
Hello, good morning, doctor.
Good morning, my brother.
Yes, sir. Please, I have one question that I want to know.
Please go ahead.
Yes, sir. Please, I heard that somebody with HIV, there are some blood that HIV cannot be contacted. Is it true? Well, then the second one, like how many years will somebody stay before the AIDS will surely reveal from his body?
Okay, thank you very much. Now let me start from the first question. There's actually no blood type that an individual will have that will make it impossible for the person to pick up the HIV infection.
So if you like be O positive.
Yes, there's no blood group that is resistant to it. Let me put it that way. However, we have seen a situation where a couple, in which situation one of them may be infected or one of the partners may be infected and one may not be infected. Yeah. And with sexual exposure between these two individuals, one will still not be able to pick up the infection. We call them serodiscordant couple. It has happened. A number of documented evidences exist of such, but that is not to say that it was related to such an individual having a particular blood type or the other. No, that's not the teaching. Or
what
that's
can
not.
We say is responsible to that, sir?
It's still a subject of ongoing research at the moment to find out why that can be possible. I'm talking about an individual who is not on antiretroviral therapy, ARTs. An individual who is not on drug for suppressing the infection. Such an individual will still not be able to pick the infection. Okay? So that can exist. Now, coming to the second question, what number of years can an individual have HIV before it begins to manifest? For different individuals, it could happen at different times. But we do know that usually an individual can go without manifesting any symptom, without progressing to the level of AIDS for between 3 to 20 years. But on the average, is about 7 to 10 years. That's about the time.
Have been in the body.
Yeah, the virus could be in the body.
But if you go for test, will they detect at that period?
If such an individual goes for test, it will be detected, and of course, such an individual can infect others. Okay. Bayo from Lagos. Good morning, Bayo.
How are you doing, Bayo?
Good morning.
Good morning, my brother.
I'm fine, I'm fine.
Okay, go ahead with your question, Bayo.
Okay.
Please go ahead.
Hello, good morning, doctor.
Good morning, my brother.
Hi there, doctor, how is the family?
Fine, thank you, sir.
How is everybody?
Fine, thank you, sir.
And how is the clinic?
We thank God. Thank you, sir.
Yeah, but we are thinking of a couple where the two couples are infected. Hello?
And with you?
Hello?
We can hear you.
He's
Go
with
ahead.
you. Please go on. Mr. Bayo, speak up.
Hello, with the couple. Why the couples are infected? What is how would they interact? Hello? Hello?
Yes, we can get your question.
But I think he got the question.
Thank you very much for using the coded language. Yeah, he asked a very important question. A while ago, we talked about the concept of discordant couple in a situation where these days we use partners, not couple. Okay, so in a situation where a partner has it, why the other partner does not have. So how will they interact? Okay, interaction is in quote now. How will they interact?
Or copulate.
Yes. Okay. Now, that has been possible. Okay. As a matter of fact, such individuals or such couple can actually give birth. They can have offsprings that will not have HIV at the end of the day. And of course, that cannot be done with practicing of a barrier contraceptive method during the so-called interaction now. Okay, so what can happen in such a situation is that ideally, the infected partner will have to put on antiretroviral drugs for some months. Usually, if the person is on drugs, such drugs, for about 5 to 7 months, the person needs to monitor the level by way of blood testing. So you don't just say, because I've been on these drugs for this length of time. And suffice also to point out that there are no breaks in between if you're on such drugs, no holidays. You need to be on the drugs constantly, okay? Because like we saw in that video, what the drug does is that it suppresses the virus, not that it cures it. For now, HIV has got no cure, okay? There are several attempts at getting vaccine and all whatnot. We'll talk about that as we go on in the presentation. Okay, so what happens is that such an individual, if he could get to a level by way of monitoring the progress of the treatment, it could get to a level when such an individual will be at a level that the virus will not be detectable in such a person's blood. At such a time, the person can be advised to have interaction, if I could use his own word, okay, to have sexual exposure, okay, with the partner. If the partners happen to be male and female, such a person will be advised to go in at that time, and of course, that can result in pregnancy and such a baby. Also, there are protocols for managing pregnant women that have this condition so that the baby will not get it at the end of the day. So that is possible, sir.
Okay, very good.
Now, talking about signs and symptoms of HIV, like I said at the beginning, depending on the stage of the HIV, okay, that will depend on the type of symptoms that one will have, okay. But let me run over them again. At the acute stage, the person can have flu-like symptoms that usually will last between a space of 2 to 4 weeks, okay. Among them are fever, raised temperature. The person could have fever. The person could have recurrent sore throat. The person can have lymphadenopathy, swollen lymph nodes, okay. Usually this can last for some few weeks to few months and it resolves, okay. Now when it gets to the second stage, the chronic stage, there may or may not be these symptoms anymore, but towards the end of the chronic stage, the person, depending on whether the person is receiving treatment or not, the person can start having some more significant HIV symptoms, okay, which are unintended weight loss. You discover that the person is losing weight unduly, not that because the person has chosen to do a weight reduction program. The person could be having night sweats. The person could be having affectation to some of the organs, okay. Gradual damage of the organs will be in the picture, okay. At that stage, the person may have prolonged diarrhea. Apart from weight loss, the person could have prolonged diarrhea, okay, which can actually contribute to the weight loss as well. The person could also have recurrent fever, okay. So you could have weight loss at this stage. You could have prolonged diarrhea. You will have Sarah from FCT.
How you doing, Sarah? Good morning, Sarah.
Good morning, sir.
How you doing?
I'm fine.
Okay, go ahead with your question. The doctor is here.
I'm fine. Good morning.
Yeah,
Good morning, Sarah.
Good morning, doctor.
Yeah, good morning to
Your
you.
voice, are you sleeping or just waking up?
No. Please, I want to ask if a child with HIV. Hello, can you hear me?
Yes, we
yes,
can.
we can.
Okay. No. Please, I want to ask if a child with HIV can grow healthy.
I didn't
Can
get
you
that.
turn down your volume and then
So that
take
I
your
can hear
question
you.
again?
Did you get that?
Are you hearing me?
Can you reduce your volume
Reduce your
first
volume.
off? Then you can now repeat your question.
Hello.
Sarah. Okay, so we admonish that you call us back. You need to always reduce your volume, before you call, so that we'll feel relate with you well. So please try and call us back, and of course, make sure your volume is okay for us to talk with. Okay, doctor.
Yeah, thank you. So those are symptoms you could have in the second stage towards the chronic stage. But when the person is graduating to the third stage, which is the AIDS stage, the person can actually have some CNS involvement. The person can have encephalitis, okay, which is inflammation that has to do with the brain, okay. The person can have lung infection. Top on the list is pneumonia. It's very common in them, okay. Such a person can have tuberculosis as well. As a matter of fact, tuberculosis and HIV are regarded as cruel duet. Usually, majority of people that have HIV, sometimes they do also have tuberculosis. That is not to say that everybody that has HIV must end up having tuberculosis. Okay. So that is why it is important
that everybody will get tuberculosis
get
can get HIV. No, it doesn't follow that way. Okay, so but one of the chest infections that are common in them is tuberculosis, apart from pneumonia. Okay, a person could also have, that's the third stage now, age-defining infection that we're talking about. Person can have tumors. A number of them, like Kaposi sarcoma, which we have mentioned a couple of times. Person can have lymphoma, and then when such a person is not receiving treatment, it can actually result in death. Okay, so you can see how the disease can actually progress from one stage to another. Okay, so I would like us to talk about.
Sorry, we have Toby. Toby, good morning. Good morning, Toby. Toby, you there?
Huh?
How are you there, Toby?
What?
Okay, the doctor is here. Please go ahead with your question, Toby.
Okay.
You need to be audible. We can't hear you.
Yeah. Is it that your volume is loud, or you dey hear wetin we dey talk, Toby?
Yes.
Okay,
yes,
please.
go ahead, Toby.
Now, speak up so that we feel hear you very well.
I'm coming back.
Good morning there. Can you speak up a bit for us so we could hear you well here?
Toby, how old are you?
I think he's a child.
20.
20.
Yes, so please go ahead with your question.
Adult.
Abi?
I'm calling back.
Oh, you call us.
Okay, thank you very much. Okay, so let's talk about transmission. How is HIV
Because most people believe it's just sexually transmitted.
Yes. Now, there are a number of routes of transmission of HIV. Okay, top on the list, because I've mentioned, is actually not top on the list at the moment. Is actually sexual.
Oh, really?
Okay, so apart from sexual transmission, you could also have mother-to-child transmission.
Breastfeeding.
Okay, now mother-to-child transmission can happen, number one, in the course of the pregnancy, during delivery, and of course, during breastfeeding. So mother-to-child transmission, which is regarded as vertical transmission, can actually happen all through the duration of the pregnancy. But that would depend if such an individual has not been started on antiretroviral drugs. But in a situation where such an individual has been started on such drugs, you can actually prevent vertical transmission from happening. Okay. Now, I also would like to comment on breastfeeding for babies that are born to HIV mothers. We'll have
how are you there?
I'm fine.
Okay, good morning. Go ahead with your question.
Soft voice.
The question is these symptoms of HIV. Good morning.
Good morning.
Yeah, it's Olua on the line.
Go ahead.
Please, my question is, this HIV, when can someone detect the symptoms? Like how many months or weeks or days or that you can detect that you are having all this HIV? Because you said something like, if you're having a long-time fever, it's normal to have a fever. So what I'm trying to say is, when like how many months or weeks that maybe you are HIV positive?
Okay.
Thank you. Thank you very, very much. Thank you very much for that question. Now, the question she asked, when can one actually know that he or she has HIV? Going by the symptoms alone, it's a difficult question to answer, because like what she said, we pointed out that at the beginning, 2 to 4 weeks, such an individual could have flu-like symptoms, could have sore throat, could have fever, which could be persistent for a period of time. These are symptoms that you can have even with malaria and some other disease component that we know in this environment. Typhoid can give you such presentation as well. Sure. So it's difficult to actually say, going by those initial set of symptoms, that one has HIV. However, some people too who are equally infected may be asymptomatic, may show no symptoms at all. Okay, so the only way one can know is to go for HIV screening or HIV testing. So that's why we encourage everybody to ensure that you know your status. We must ensure that we all know our status from time to time. Now, talking about the screening, depending on what method of screening that is being used, some screening may not pick it until it is about 3 months. Okay, but I can tell you that there are newer screening methods that can actually pick HIV within a space of a month or even earlier. Polymerase chain reaction testing can actually pick it within a space of 1 month. Okay, so it doesn't have to be 3 months, but the usual rapid testing kit that we use will actually not be able to pick it until after some few months. Okay, so that's the only way that one can know. But some people may not even know until they probably have progressed to that stage of AIDS.
Okay. Let's take Blessing. Good morning, Blessing.
Good morning.
How are you there, Blessing? Please, you need to be audible so that I can hear you.
Okay, good morning.
Yeah, good morning.
The doctor is here. Go ahead with your question.
Okay. I said, please, I want good morning.
Good morning.
Good morning. Good morning.
Can you lower the volume of your TV so that we can hear you?
Okay. I said, I want to ask a question. Like you said, HIV during there are some stages.
We can't hear you.
Okay, hello.
You need to be audible, Blessing, please. You need to be audible.
Turn down the volume of your TV so that we can hear you.
I have turned down the volume of my TV.
So
go ahead.
Can you hear me?
Yeah, sure,
yes,
we can. Better.
Okay. I said, you said HIV do come like some of the symptoms include infection. Like the infection, like those, let's say like discharge from the penis, is there also a symptom of HIV?
Oh, okay, yeah, I think I got her question. Okay, so she was taking us back to the symptoms. So penile discharge, if I got you right. I'm not sure I got you right, but I think that was what she said. So her question is, could penile discharge be a symptom of HIV? Okay, now penile discharge may or may not be a symptom of HIV. Now, I will explain what I mean by that. It is a well-known fact or documented, there are documented evidences that people who have sexually transmitted infections like gonorrhea, chlamydia, and all other ones have an increased risk of picking HIV infection. Okay, or some people who have sexually transmitted infections, okay, usually those ones that can leave sores behind. So it's possible for someone to have sexually transmitted infection coexisting with HIV. Okay, so that can happen in some situations. Okay, but penile discharge on itself, on its own, can actually not be taken as one of the symptoms of HIV. Okay, so we are still on routes of transmission of HIV.
And I
so
think
we just continue.
Yes.
that we will have to pause you and thank you, sir, so that next week we can pick up from there. From every one of us, I want to say thank you very much. When they always stay tuned. You know, say health matter a lot. Chief Olododo Naibe, my name.
Thank you very much. So we'll see you next week.
Yeah, see you guys 1 to 2.
So we'll commence from transmission.
Transmission.